Welcome to Optimal Health. Today we're going to talk about early cancer detection. The earlier we detect cancer, the better our chances of curing it. We'll see together the symptoms of cancer that should never be ignored. Small changes, sometimes very simple, but which can mean something more serious. Please remember, this video is not a substitute for a doctor's appointment. If you notice any of these symptoms, go see a healthcare professional. Let's start with what happens in the bathroom. It's a subject that many people find embarrassing, but it's crucial to pay attention to these signs. Our bowel movements and urinary activity can tell us a lot about our health. In fact, these bodily functions are often the first to show signs of underlying problems. An unusual change can be a sign that there is a problem. Let's talk about the intestines first. The intestines play a vital role in our digestion and overall well-being. Sudden constipation that lasts, unexplained diarrhea, or changes in stool consistency can indicate problems. For example, persistent constipation can be due to a lack of fiber in the diet or dehydration. Thinner stools than usual can be a sign of intestinal narrowing. It is important to note the shape and consistency of your stools. Blood in the stool, whether bright red or black, is a major red flag. This may indicate hemorrhoids, but also more serious conditions such as ulcers or cancers. All these signs should alert you. Do not ignore them and consult a healthcare professional for an accurate diagnosis. It's the same thing for bladder changes. The bladder is an essential organ for eliminating liquid waste from our body. A more frequent urge to urinate, difficulty urinating, or changes in the color of urine can be signs of problems. For example, a frequent urge to urinate may be due to a urinary tract infection or an overactive bladder. A burning sensation when urinating is often a sign of a urinary tract infection, but it can also indicate other more serious problems. Blood in the urine is another red flag. This can be caused by infections, kidney stones, or even cancers. Of course, these symptoms can be related to urinary tract infections or other benign problems. However, it is always best to consult a doctor to rule out any possibility of more serious conditions. But sometimes they can be a sign of colorectal cancer or bladder cancer. These cancers can be effectively treated if detected early. Early screening greatly increases the chances of successful treatment. Regular testing and careful monitoring of your body can make a big difference. So, be attentive to your body and do not hesitate to consult if you have any doubts. Your health is precious, and prevention is better than cure. Take care of yourself and listen to the signals your body is sending you. Now let's move on to another symptom: wounds that don't heal quickly. Our skin is our shield. It's constantly exposed to aggression. Cuts, scrapes, burns. Most of the time, these minor injuries heal quickly, but sometimes, some wounds are more difficult. They don't heal, they stay red and inflamed, they ooze, or they bleed easily. If a wound takes more than a few weeks to heal, see a doctor. A wound that does not heal may be a sign of infection, poor circulation, or even an autoimmune disease, but it can also be a symptom of skin cancer, such as melanoma. See your doctor or a dermatologist as soon as you see a wound that is not healing normally. Now let's talk about unusual bleeding or discharge. These phenomena can be worrisome and confusing, but it is crucial to understand them and know how to react. Our body is a complex machine, and sometimes it sends us warning signs like bleeding or strange discharges. These signals can be important indicators of our overall health. For example, vaginal bleeding outside of your period can be alarming. It can occur for a variety of reasons, some benign and others more serious. Similarly, blood in the urine, unusual vaginal discharge, or nipple discharge can also be signs that should not be overlooked. These symptoms can vary in intensity and frequency, but they always deserve special attention. All these signs should alert you. It is essential not to ignore them, even if they seem minor or occasional. Of course, they don't always mean it's cancer. These symptoms may be caused by less serious conditions. They can have benign causes, such as an infection, a fibroid, or hormonal changes. For example, a urinary tract infection can cause blood in the urine, while hormonal changes can lead to irregular vaginal bleeding. But you should not ignore these symptoms and consult a healthcare professional to find out where they are coming from. Early diagnosis can make a big difference in the treatment and management of the underlying condition. Vaginal bleeding outside of your period can be a sign of cervical, endometrial, or ovarian cancer. These types of cancer can be treated more effectively if detected early. Rectal bleeding may indicate colorectal cancer, a serious condition that requires immediate medical attention, while blood in the urine can be a sign of bladder or kidney cancer. These symptoms should never be ignored, as early treatment can dramatically improve outcomes. See your doctor, gynecologist, or urologist if you notice any of these symptoms. A quick consultation can reassure you and allow you to take the necessary steps for your health. Ultimately, being attentive to your body and reacting quickly to warning signs can make a big difference. Take care of yourself and don't hesitate to seek medical help when needed. Now let's talk about a symptom that is often scary: the appearance of a lump or abnormal thickening in the body. These lumps can appear in different parts of the body and are often discovered by chance. Most lumps are not serious; they can be cysts, lipomas, or other benign formations. However, some may be a sign of cancer, and it is crucial not to ignore them. Regular breast palpation is essential for women, but also for men. Indeed, it makes it possible to detect possible anomalies at an early stage. These abnormalities may include a hard, painless, immobile lump, a change in breast size or shape, dimpling or retraction of the skin, nipple discharge, or unusual redness or warmth. It is important to note that these signs are not limited to the breasts. A lump can also appear in other parts of the body, such as the neck, armpits, groin, or testicles. An increase in abdominal volume can also be a warning sign of cancer. It is therefore essential to remain vigilant and to monitor your body regularly. If you discover a lump or abnormal thickening, don't panic. Make an appointment with a doctor for a thorough examination. Early diagnosis can make a big difference in treatment and prognosis. It is important not to ignore the signs and to consult quickly. Remember, the earlier a cancer is detected, the better our chances of curing it. Survival rates are much higher when cancer is caught early. Early detection and prompt treatment can save lives. Be attentive to your body and take care of your health. Now let's move on to a symptom that may seem harmless, but which can hide something more serious: difficulty swallowing. Swallowing is a natural act, but sometimes it is difficult or even painful. If you experience discomfort or pain when swallowing, a feeling of food blockage in the throat or esophagus, a persistent cough after eating or drinking, heartburn, or unexplained weight loss, it is important to see a doctor. Difficulty swallowing can be a symptom of several conditions, such as gastroesophageal reflux disease, a hiatal hernia, or an infection. But it can also be a sign of cancer of the esophagus, throat, or stomach. Do not wait for the swallowing difficulty to worsen or become unbearable. Let's now focus on our skin, and more specifically on moles and warts. These small, often harmless marks can sometimes change and become cancerous. A mole that changes size, shape, or color, that becomes irregular, itchy, bleeds, or turns into a sore that doesn't heal, should be examined by a dermatologist. It's the same thing for warts that grow quickly, that change in appearance, or that become painful. Melanoma, an aggressive skin cancer, can develop from an existing mole or appear on healthy skin. Remember the ABCDE rule to help you spot suspicious signs of melanoma: asymmetry, border irregularity, color variation, diameter greater than 6 millimeters, evolution. Finally, let's finish by talking about a common symptom, often trivial, but which can sometimes hide a more serious illness: a persistent cough or hoarseness. It's normal to cough from time to time, especially in case of a cold, flu, or allergy. But a cough that lasts more than 3 weeks, despite treatment, should alert you. It's the same thing for hoarseness that lasts more than 2 weeks, especially if there are other symptoms such as difficulty breathing, sore throat, or coughing up blood. A persistent cough or hoarseness can be a sign of a chronic respiratory infection, such as chronic bronchitis or chronic sinusitis, but they can also be a symptom of cancer of the lung, throat, or thyroid. If you have any of these symptoms, don't wait to see your doctor or an ENT. There you go. I hope this video has helped you better understand the symptoms of cancer not to be ignored. Remember that prevention is our best weapon against this disease. Feel free to subscribe to our channel for more health tips and share this video with those around you. Take care of yourself and see you soon on Optimal Health.